All life depends on air and water, yet 99% of the water on our planet is salty or locked up in ice. Only 1% can be used for human agriculture, manufacturing, community and personal needs. Unsafe drinking water, inadequate sanitation and poor personal hygiene contribute to 4 billion cases of diarrheal disease every year in developing countries, killing more than 1.5 million people, mostly children under 5. To prevent these unnecessary deaths, people are changing the way they think about water in their homes. Household water treatment and safe storage techniques, known as HWTS, are simple, cost-effective ways to prevent disease and improve the lives of children and their families. HWTS products can be used to make unsafe water potable, as well as purify drinking water that may have become contaminated during transit or storage, even if it was safe to drink at the source. The Safe Drinking Water Project, funded by American Express, underway in Guinea, Angola, the Democratic Republic of Congo and Tanzania, aims to change behaviours in the home. Even if water flows safe and clear from a local pump, dirty containers, dirty hands or unsanitary storage can contaminate it, leading to disease and even death. The project informs people about the dangers of unsafe water and how they can protect themselves by treating their daily supply at home, with inexpensive products available in their local markets. But treating drinking water is not enough. The water must be stored safely in the home to ensure it remains uncontaminated until consumed.
It became clear to me that if we were going to try to achieve health gains, that it wasn't enough to intervene at the point of distribution. We had to ensure the microbiological integrity of the water right up to the point of consumption.
The thinking behind household water treatment and safe storage techniques goes hand in hand with other hygiene and sanitation initiatives, such as hand washing with soap and the use of sanitary latrines, and other behaviour change interventions like exclusive breastfeeding, the use of zinc and ORS for the treatment of diarrhoea, and sleeping under insecticide-treated nets to prevent malaria. This type of package has recently been adopted by Tanzania.
To fulfill its commitments towards attaining the MDGs, the government of the United Republic of Tanzania, through the relevant ministries and stakeholders, took deliberate measures to initiate a national process for scaling up on household water treatment and safe storage.
The chlorine-based purification products are inexpensive, easy to find and use, and reliable. In Angola and Guinea, the products are manufactured in-country, both providing a livelihood for local people and sustaining local demand for additional HWTS products, such as ceramic and slow sand filters and solar disinfection. Focus groups are used extensively to test product packaging and user instructions to make sure even illiterate or semi-literate groups are able to use the product properly. First-hand knowledge of local culture and context is of crucial importance when designing communication initiatives to help change behaviours and improve people's lives. Naturally enough, mothers and women are the principal entry point when educating populations about safe drinking water, as they are the primary caregivers for young children and also the most likely to influence behaviour in the home. Communications campaigns have included elements such as demonstrations and free samples in local markets and are targeted specifically at women. To ensure maximum impact of HWTS initiatives in each country, local social marketing groups help devise context-specific communication campaigns, incorporating everything from mass media to one-on-one personal appeals. PSI, Population Services International, is one of the main implementers around the world in promoting this approach to social marketing and communication initiatives. PSI trains government officials, local NGOs, community outreach workers, and encourages local markets and retail outlets to carry HWTS products.
Certeza is a product which is manufactured locally. It took several years to design and to obtain the necessary approvals so that the Ministry of Health and all of the government of Angola counterparts had the confidence that it could safely treat water at the point of use. And it was introduced commercially in Angola in 2008.
The private sector plays a dynamic and varying role in each project country, creating local demand for locally manufactured HWTS products and supporting behavior change interventions. In the Democratic Republic of Congo and Tanzania, private sector partners work with government to promote Aquatabs. Offering products in individual doses, for example, ensures that they are affordable to all. To stimulate initial demand for HWTS products, Purification Solution is distributed free. Communicators explain the importance of using the product and explain how to do so correctly. Once people are conditioned to using purification and storage products at home, the idea is that they'll be willing to pay for them, investing in their family's safety. Once this demand has been created, the entire structure becomes self-sustaining, empowering people and allowing them to take control of the health of their children and their families. Emergency situations such as cholera outbreaks in Angola and Guinea provide an additional opening for HWTS products to be introduced into the population, most often via a free and rapid distribution of locally made products.
Since we've started using Suro, we've seen great progress in the prevention of cholera. Without Suro, I think we'd be faced with outbreaks of cholera in Guinea almost every year.
In other countries, emergency water and sanitation supplies are procured abroad due to the large numbers of people needing urgent assistance. Thus, an emergency, whilst often traumatic, can have the spin-off effect of stimulating interest in HWTS products in an everyday development context. Conversely, countries that have existing household water treatment and safe storage projects in place are better prepared in the event of an emergency, as people are already using the products. Three-quarters of the planet is covered by water, yet only 1% is available for humans. The Safe Drinking Water Project and similar initiatives promoting household water treatment and safe storage are of vital importance to help ensure that this water stays safe, from the well or pump to the drinking glass, resulting in healthy families and healthy societies.